Hi, my name is Emma Roxman, and today we will be talking about reflexes. Reflexes are the overt stereotype movement made in response to a specific stimuli. For example,
this is the startle response. Go.
While this was a comical example, reflexes are key components to motor development. In particular, reflexes that occur prenatally and at birth are an important sign of overall health in a baby. In particular, preterm infants are tested for these reflexes to determine their health and stage of development. As previously mentioned, reflexes are overt stereotype movements made in response to a specific stimulus. They're involuntary, coordinated muscular action, very sensitive to stimulus properties, and sensitive to physical context such as posture and arousal state. Some reflexes are permanent, however many are seen only in childhood. We can categorize reflexes seen during infancy into three types of movements: primitive reflexes, postural reactions, and locomotor reflexes. In this video, we're going to focus primarily on primitive reflexes and how they are affected in premature infants. If you are a parent to a prematurely born infant and your infant does not exhibit these reflexes, this may be a sign of a damaged central nervous system. Please take them to a doctor to be checked out immediately.
First, we're going to talk about the root reflex.
The root reflex occurs when the sides of the face or the corner of a baby's mouth is stroked or touched. The baby will turn his or her head in the direction of the touch and open their mouth. By doing this, the baby follows or roots in the direction of the stroking. This action is important because it helps the baby find the breast or bottle for feeding. For prematurely born infants, this action is sometimes weak or completely absent. In a study done by Barlow and colleagues in 2001, it was found that infants' suck can be modified or trained using mechanical stimulation by an actifier or mechanical pacifier. This is one way to stimulate the rooting reflex in premature infants, so if this action is weak or delayed in your baby, don't panic. Ask your pediatrician if there are methods at home you can do to strengthen your baby's rooting reflex.
Next, we will talk about the grasp reflex.
When you stroke a baby's palm, it will cause the baby's fingers to close in a grasp. This reflex lasts for 5 to 6 months of age. The grasp reflex is important because it provides the gateway for your baby to begin eating, playing, and eventually writing. In 1982, in a study done by Field and colleagues, it was shown that natural caregiving behavior, such as gentle stroking and grasping, such as in the rooting and grasp reflex, showed increased stimulation in human growth hormone in premature infants, which is a physiological index of stress in preterm infants. Prematurely born infants undergo stressful events in the neonatal intensive care unit after birth. Gentle contact and tactile movements appear to be examples of effective alleviators of the baby's stressful intensive care experiences. If your baby does not exhibit the grasp reflex, for example, picking up a toy you set in front of it, or attempting to pick up food, discuss your concerns with the pediatrician. Sometimes premature babies reach this motor milestone later than their peers. Ask your doctor for a time frame in which you should look for this reflex. If your baby still has not exhibited this reflex outside of the time frame, it may be indicative of something greater.
Lastly, we will discuss the Moro reflex.
The Moro reflex is often called the startle reflex because it usually occurs when a baby is startled by a loud sound or movement. In response to the sound, the baby throws back his or her head, extends out the arms and legs, and cries, then pulls the arms and legs back in. A baby's own cry can startle him or her and trigger this reflex. It can last for 4 to 5 months in infants. The primary significance of the Moro reflex is to evaluate the integration of central nervous system and is believed to be the only unlearned fear in human newborns. If your premature baby does not exhibit this reflex, it could be a sign of a bigger issue. In 1986, Allen and Caput observed the Moro reflex, among others, in babies as premature as 25 weeks, post-conceptional age. These findings indicate that the Moro reflex should still be present even in extremely preterm infants.
In conclusion, reflexes are very important tools to diagnose the overall health of your baby. If your child was born prematurely and does not properly exhibit these reflexes, please have them checked out by a pediatrician.